Hello, good evening. Assalamu alaikum. How's everyone? Hello.
Hello, good
Hi.
evening.
Hi, good evening.
Assalam wa rahmatullah.
Walaikum salam. How are you?
I'm fine, thank you, Zaib. How are you?
I'm good too. I'm good too. Good to have you here.
Thank you.
Okay, that's great. So I can see we have got a couple of participants. I know Sarah, Abira, and Amreen, Haya. Who is iPad and iPhone? I would request all of you to change your name, please. So it would be easy for me to, call out your names as well. Shumaila, Swati, Abda, Sadia,
Hi,
and
Subhashni here.
hi, Subhashni. How are you?
Hi, I'm fine.
Okay, that's good. Good to have you here. So I can see Sahar as well. Sahar, yeah, she's here. Okay, that's great. Okay, so many familiar names as well and faces as well. So it's always good to see the familiar faces around. So I can see Sir Hassan has joined as well. Hello, Sir Hassan. Salam alaikum. How are you?
Hello, Dr. Zaib. How are you?
I'm good, alhamdulillah. How are you?
Just joined. I was following another link, so it's just realized that this is the true link or the correct link. That's why I'm late. Thank you so
Okay,
much, Zaib. How are you? Everything is
I'm good.
fine.
I'm good. Alhamdulillah, alhamdulillah. Everything is good.
That's
Thank you
great.
so much.
That's
So how
great.
about you?
I'm
So
fine. Thank you so much. Thank you.
okay. So yet again, we are starting another batch from Med Exam Expert platform. So you all know us, me and Sir Hassan as well. Okay. So we both are going to give you an overview about the part 2 MRCOG exam. And of course, we are going to give you some of the tips and tricks how to pass exam. And later I will try to discuss, if you guys are up to, then I can discuss, a small guideline about was a previa and the how we are going to deal with that guideline and plus how to read the guideline and make your own notes as well. Okay, so I hope I really want all of you to be interactive in this session rather the being dormant or silent. Okay, so if you guys have any kind of question you guys can ask, and if there is any kind of ambiguity or query you guys can ask as well. Okay, so I hope my voice is clear to all of you. Is it, or is it
Yes,
Yes.
please.
Okay, fine. So, Sir Hassan, your opening statement for the course and everything.
Yes. Thank you so much for everybody to be here today with me and Dr. Zaib. We are used to conduct this course maybe from 2016 regularly,
Yes.
twice or three times per year according to the exams by RCOG. And we are thanking God a lot, alhamdulillah, that the outcomes are really good. And we successfully helped a lot of colleagues to be members now in the Royal College. And, it's not about a job or a work or something like this. It's about the passion. So Dr. Zaib, me, and other people in the organization of Med Exam Expert, Dr. Brania, Dr. Buja, and all of them, we are all finding our passion in teaching and helping people. Exactly. So this is why we are still, after all these years, still working very hard to update ourselves, to keep our knowledge, to the top, following every single guideline here or there to deliver the best knowledge and best information to all our friends. So Part 2 examination is the most difficult step in MRCOG, okay? The MRCOG, 3 steps. I believe that the second part is the most difficult one. Am I right, Zaib?
Oh, yes, exactly. Because we have to study a lot. We have to study all guidelines and talk articles and blah, 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 so many things. And with the passage of time in the recent years, it has been so competitive. And it has been
Very
so
competitive,
difficult.
yes.
Yeah,
And,
it has been difficult.
it's now not about only the difficulty of the exam itself. It's that there is a more difficulty problems to have a seat in the
Seat.
exam. Now
Exactly.
there is a
Exactly.
competition in seats. So I suggest that if you have a pass card to attend the exam, you have to do your best to pass, because this opportunity may be later on being either difficult or taking a lot of time. So part 2 MRCOG, the problem is the curriculum is limitless, unlimited. Boundaries are not visible and demarcated enough. So if you cannot follow the recommendations and clear lines to study in, you will find yourself lost, like you know, a sailor in an ocean. Okay. If you have no compass, if you have no guide, you will be lost. So this is our mission. We are, you know, that I'm always saying the same. Knowledge are everywhere. Guidelines are accessible to everyone. But if you cannot find a true guide through your journey, you will find yourself really lost, because the knowledge is abundant. Okay. And not, you know very well the trick. Not all knowledge is important.
Exactly.
Not all knowledge is important. Not all sources are recommended. So you may find such a certain topic like infertility, for example. Okay. You can find 3 or 4, maybe 5 different recommended sources, nice guidelines talking about infertility, TOG articles, many articles talking about infertility, scientific impact paper, and so on. So which one to follow? Sometimes there are some contradictions between these guidance. So which one to follow? This is the trick. You need somebody to take your hand to pass this exam. And this is what we are doing in this course. You know, when we attended the part 2 exam and part 3, me and Dr. Zaib, almost there were no courses anywhere.
Exactly.
I remember we tried to do our, you know, our notes by ourselves, trying to collect the most important points, and we learned by trial and error. Imagine that. Now you have a golden opportunity to gain the knowledge, gain the experience, and pass from the first shot. This is a great opportunity. You have to utilize it. The mic is yours.
Exactly. 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 So in today's session, of course, we are going to talk about that, you know, what exactly the part 2 is and how we are going to deliver our knowledge to all of you. Like, I mean, most of you guys know that me and Dr. Hassan, we both are RCOG examiners as well. And you can see our pictures over here too. So I did try to extract the best out of, you know, the pictures. So this is going to be me, Dr. Zaib Qureshi, with you throughout your journey, along with Dr. Hassan. And he has been, you know, the teacher of all of us, and, you know, such a dear friend as well.
Thank
So I
you
hope
so
you
much.
guys will have you know, the good time with us as well, because, you know, moreover, we do try to deliver knowledge along with you know, a lot of ease, a lot of you know, the kind of, what you can say, that, you know, we don't burden ourselves, we don't burden our, you know, the students as well. We do try to deliver in a friendly environment, and in an environment in which we believe that, you know, we can extract the best out of everybody. So it's not like that, you know, this is just going to be you know, the kind of professional kind of the talk all the time, that, you know, we are just talking about. So you guys can reach out to us, and there are so many examples in which, you know, the candidates are so close to us that they do discuss their problems with us, they do discuss their, you know, the things with us as well, that, you know, wherever they do need any kind of guide as well. Okay, not in terms of course, the exam and everything, but anything. So our doors are open for all of you guys as well. So if you guys need any kind of help, any kind of emotional support, any kind of the kind of in fact the support in terms of knowledge and everything, so you guys all of you are welcome as well. So this is the prestigious Royal College of the Obstetrics and Gynecologists building. So this was the building which me, Dr. Hassan, and many of us, the old fellows, have dreamt of. Okay, so I'm sure you must have seen, the famous pictures at this place. So this has been an old building of Royal College. But still, it is so memorable for me, for Dr. Hassan, because we took our exam over here. Okay, back in 2019. Yeah. So then our college got shifted to the Union Street building. So this is the new building. So I hope when you guys pass your exam, so you guys are going to go for your ceremony over there in this Union Street building. And this is a spectacular building as well. So I hope you guys are going to take a picture over here and send to all of us. Then, like, look, we are MRCOG today, and we are hoping for that day for all of you. All right. So in terms of, because, part two is all about that, how you are going to deal with it. And of course, like Dr. Hassan said, that the curriculum is limitless. Curriculum is so like kind of you can say the I mean kind of ending. It doesn't have any kind of end. You will finish one thing and you will find out, oh my god, I have finished this. No, something is left. Okay, so all the time you guys are going to have that feeling in your mind when you are going to study for this part two. So first of all, what you have to do for yourself, you have to be calm, you have to be good, you have to be confident enough that you, okay, I am going to do this exam and I am good for this exam. All right. So first of all, you have to give a reminder to yourself as well that today is a new day and it brings with it a new set of opportunities for me to act on. I am attentive to the opportunities and I seize them as they arise. I have full confidence in myself and in my abilities. I can do all things that I commit myself to. No obstacle is too big or too difficult for me to handle because what lies inside me is greater than what lies ahead of me. I am committed to improving myself and I am getting better daily. I'm not held back by regret or mistakes from the past. I am moving forward daily. Absolutely nothing is impossible for me. So all you have to do is that you have to remind yourself on daily basis that nothing is impossible for me. All right. And you have to do this promise to yourself, to promise to us, your mentors, your teachers, your guides as well, that you have to work hard because, I think, being enrolled in a course or being enrolled in any of the, the exam, the thing, what I must say, it's not going to help you until and unless you are going to help yourself, isn't it? So you have to remind yourself that nothing is impossible. What you have to do is you have to put your extra effort in, having this, the prestigious degree. When me and Dr. Hassan, we always say that, when we can do it, certainly you can also do it as well. Okay, so it is difficult. I won't say that it is a piece of cake. Yeah, it's not a piece of cake. You have to work hard. You have to put your all efforts, energy, your love to study, I mean, whatever you can name. Okay, so you have to put that into this, the journey to sail through. All right. So all you have to do is that, you don't have to be afraid of anything. You don't have to be afraid of any obstacle if it comes in front of you. All right. So remind, okay, make a note in front of your study table, in front of, wherever you study, that you have to write it for yourself, that nothing is impossible for me. Okay. So absolutely nothing is impossible for me. So I hope you guys are going to revise this on daily basis for yourself. Okay. That, how you can achieve the goal for what you are here with us. All right. So the agenda for this session is going to be that we are going to talk about briefly the curriculum. Okay, and then we are going to talk about that how to prepare for this MRCOG exam and general strategies to prepare. Okay, hang on, it's not always that how we are going to prepare only. There are certain strategies which are going to lead us to how to successfully fail an exam. So we are going to talk about that as well, because there are many strategies which can lead to that, what you want to achieve and what you want to do, but you cannot do. And there are certain factors in this preparation that, what lead to that kind of, the desperation, that lead of, the underconfidence, that lead to, somewhat, what I can say that, the depression, or you can say the anxiety as well. That, okay, I cannot do this. The curriculum is so vast. Yes, curriculum is so vast. Then in the end, we are going to talk about the course as well, for which you are enrolled in here, the candidates who are with us, plus the candidates who wants to join us. And later on, if you guys need, apart from this course, anybody, who is listening to us, who is with us, you guys, all of you are welcome if you guys need any kind of support. Okay. And if time allows, and if you guys are up to, I will discuss the Via GTG with you, that how to extract notes, how to make your own other things to revise later on. All right. So, Sir Hassan, your take on this? Anything?
Yes, it's my pleasure. Of course, let's move to the curriculum parts.
Yes.
Yes. Actually, according to this classification by the RCOG, they are classifying their curriculum for part 2 into 18 modules. Okay. You should cover these modules. And of course, some modules are more important than others. But we have a very important quote which said, if you cannot cover everything, never to leave everything. Okay, so what you cannot cover, you can take the most important things or topics from these modules, but never to miss any one of these 18 modules. Clinical skills, appraisal, teaching, core surgical skills, clinical governors, post-operative care, surgical procedures, antenatal care and maternal medicine, then the management of labor, delivery, postpartum complications, and important 6 modules of the gynecology, including general gynecological problems, subfertility, sexual and reproductive health, early pregnancy complications, gyne-onc, and urogyne. Okay, so how can you cover all of these topics? Now, this is our mission by the schedule of this course. We have 2 schedules. One of them is the mini schedule. We are offering you the different sources to cover all topics related to the module, and then you will attend the live session discussing this module. Okay, we will give the tips and tricks regarding each topic of this module in the live session. You have to do some effort to collect the information from our sources, which we are providing you before the session. Read them, take a good idea and good grip of the curriculum in this module, and then come to the live session. We will try to do our best to simplify all important information and to guide you what are the most important things to revise and to put it, fix it in your mind. Okay, this is regarding the curriculum. From where you have to study? This is the next question. Multiple sources. Green Top guidelines are considered the top highest evidence-based knowledge in our field, or for this exam, by the way. The Green Top guidelines are more powerful than any other source to study from. So, for example, if we have the same topic in Green Top guidelines and TOG articles or NICE guidelines, which one I should follow? I should follow the Green Top guidelines. Okay, they are the highest evidence body. The second source, we can move the slide, please. Yes. The second source is NICE guidelines and then the TOG articles. We will come to this point right now. Regarding the exam, all of you know that the exam carrying out 2 kinds of questions. The single best answers, which counts about 40% of the final mark of the exam, and the EMQs, which are the difficult part of the exam, about 60%. Okay, both papers, 2 papers, 3 hours each one, with 1 hour apart. Both papers carrying the 2 kinds of questions. Okay, 50 questions single best answer, 50 questions EMQs in paper 1, and the same in paper 2. The Royal College suggested that you should finish the single best answers in maximum 70 minutes and the EMQs in 110 minutes. I suggest that 1 minute for each question will be ideal for single best answer. So I suggest you have to finish or train yourself to finish 50 questions in 50 minutes to spare more time, about 20 minutes extra for the EMQs. Because sometimes, you know, the EMQs may be a long scenario. A question may be represented as a long scenario. So you have to read it once, sometimes twice, to understand the question properly. It's also depending on the nature of the question. Now, single best answer are unidirectional question. What does that mean? It means that the single best answers are always asking about certain point in knowledge. Okay? What about the EMQs? The EMQs are considered complex questions. They are asking about knowledge plus how to interpret this knowledge, how to apply this knowledge. So always the questions in EMQs are complex in nature. So they require more time to understand and interpret the question properly in your mind so that you can find the true answer. We will try to train all of you. How can you deal in the exam itself with these kind of questions? Both
Exactly.
of them. Yes,
Exactly.
yes. Now, I think the next point we will talk about, the sources. 60 to 70% of the curriculum are from the Green Top guidelines and NICE guidelines. Green Top, as I said, are the highest evidence. Now, there are no conflicts between Green Top and other sources. Which one I should follow? Green Top. NICE guidelines are not only established for gynae and ops. The NICE guidelines are serving all kinds of medicine. That's why we have certain guidelines from the NICE we should study, like urogynae, like subfertility, like preterm labor, menopause, and diabetes in pregnancy. They are about 6 or 7 guidelines only. Post-operative care infection control and the cesarean section NICE guideline, intrapartum care and cesarean section. They are the maybe 7 maximum guidelines you should study from NICE. Other sources, TOG articles. Most of people said you have to cover the last 3 years of TOG articles. The problem in TOG articles that every year we have 4 volumes or versions of TOG articles. So they in each volume the articles are varying in number between 5 to 7 or 8. So if we take the average 6 and 4, so you are talking about 24 articles per year, okay, which are a huge number to study. But fortunately, not all TOGs are important for your exam, because sometimes TOGs are discussing advanced information, advanced topics, which are not involved in your exam as a trainee. Sometimes the discussion may be at the level of consultants. Okay, so for example, if you have a TOG article of PGD, pre-implantation genetic diagnosis details, okay, do you think that the PGD is appropriate at the level of trainee? Impossible. the PGD details are important for the subspecialty of subfertility, doctors, registrars, and higher levels. So don't study this TOG article, for example. It's out of scope. And this is also our mission, to do some filtration to the TOG articles so that you will only concentrate on important topics. What about the BASH guidelines? The BASH guidelines are always talking about different topics. Most importantly for our curriculum are the guidelines, BASH guidelines for infections. This is our source to study different kinds of infections, vaginal infections, sexually transmitted diseases, and sometimes certain infections with pregnancy if there is no green top guideline talking about this. For example, you will find some PASH guidelines and recommendations for HSV with pregnancy. Okay. But I have green top guideline for herpes simplex virus in pregnancy. So at this point, I will follow green top. You got my point. Exactly. So the NHS cervical screening program for colposcopy guidelines and how can you apply successfully and manage cervical problems. The scheme of NHS should be followed at this point. This is the only source. The Faculty of Sexual and Reproductive Health guidelines, they are, you know, the faculty is completely separated from the RCOG. It's a separated faculty with a separated certificate, other degree than MRCOG. So if you will try to read the whole guidelines of FSRH, you will be damaged. So we will just taking the superficial information about the family planning methods, the risks associated with hormonal contraceptions, non-hormonal contraceptions, and so emergency contraceptions. Otherwise, no need to go for more details. What about the consent advice guidelines? I mean, the other name is clinical governors guidelines. They are very important in numbers and in risks evaluation, because any procedure or the most common procedures in UK, the clinical governors and consent advice guidelines are discussing these procedures regarding the common risks, rare risk, additional possible procedure, how can we avoid it, and what are the incidences of each problem. So they are important to cover surgical core module and surgical procedures. That's just for this module. Some good practice papers, I think Dr. Zaib and me, we have a good idea about the most important papers like this. So we will discuss them in between our discussions, okay? For example, a scientific impact paper is talking about botulinum toxin injection in a cases of urogyne. So I will give you this idea while I'm discussing the OAB treatment, for example, okay? In between the discussion. Sometimes Dr. Zaib, when she's explaining the management of labor and delivery, there is a famous good practice guideline or paper for delayed cord clamping, okay? So she will discuss this point with all of you in between our discussions. No need to revise them separately, I think so. And finally, the last or the updated Embrace UK reports for the maternal and neonatal mortalities. They are updated every 2 years, and they are important somehow to identify what is the level of care services in UK for the mother and the babies. So you should be aware about the most common cause of direct mortality rate, indirect, coincidental, what is meant by incidental or accidental death. These points also will be discussed in details. Next, please. Now, this is the the tables of the green top guidelines you should remember, as well as the NICE guidelines later. All of these topics will be discussed in details. This is the NICE guidelines. I said, yeah, you know, the diabetes, hypertension will be discussed in maternal medicine. Infertility and urogynecology are important. Cesarean section is an old one, and I don't think it's involved in our new format of the exam anymore. But we can talk about a little bit about with intrapartum care. Menopause is critically important. Preterm labor. Sometimes the 1/3 of the obstetric questions in the exam were asking about preterm labor management. You know, if you missed preterm labor guideline, you will miss 1/3 of the exam questions. So it's disaster in the exam. Okay, and postnatal care with mental health care. I think, I don't know, but I suppose that these topics are more important for part 3 rather than part 2. What do you think, Dr. Zaib, about this? This is my point of view.
Yes, exactly. Rather, we are going to study the postpartum psychosis. That is an important TOG article. Domestic abuse, that's an important TOG article. Sexual assault, that's an important TOG article.
Yes.
So we are going to cover all these TOG articles rather than, you know, this NICE guideline.
Exactly.
Because it's an old guideline. So we have to follow the new one. Yeah.
We have certain famous problems postnatally, like postpartum psychosis, psychological problems, sepsis, postpartum hemorrhage. We have another sources to read the postnatal care rather than the NICE guideline.
Exactly.
Then the next will be, then after the NICE guidelines, the TOG articles.
Sir,
Okay.
the TOG articles which are not covered in the last 3 to 5 years, so they are basically the maternal medicine, you know, the TOG articles moreover. And of course, if you can just, you know, see the topics like cystic fibrosis, headache, enhanced recovery, nerve injury, spinal cord injury, skin eruptions, hyperprolactinemia, then SLE, appendicitis, then some of the core surgical skills like, I mean, the perforated uterus, incisions and sutures, abdominal cerclage, bariatric surgery. So these all are the TOG articles which you have to cover. Anything which we are missing, Dr. Hassan? I don't think so.
Yeah, no. What I would like to say is, for example, I will give you just an example. Yeah, we have missing here one of the most important. Yeah, I find it. Look at number 7, hyperprolactinemia, for example. This is a TOG article 2012. Look at number 11, perforated uterus. This is 2013. Okay, it means it's released maybe 7 or 8 years ago. Some papers like them maybe 10 years ago. Why we are studying them? Because they are the only source for this topic. No alternatives, no updated sources. Okay, so our job is to bring for you the old important TOG articles which had no alternatives. We need to study them for the exam. Of course, we have some new articles in 2022, but you know the game. I don't think they will be involved in September exam. They will be involved, I think, in January 23. Okay, so no need. We will try to doing some filtration to the most important thing. But I think these topics are very good to be covered for the exam. I would like to say something, Zaib. I don't know if you are agreeing with me. I'm always saying that the exam questions, you have 200 questions in the exam. Okay? Now, 10% of these questions are maybe very, very difficult and sophisticated for most of people. Okay, so 90%, 95% will miss this 10%. Okay, now there is about 10 to 20% of questions are maybe recalls. That's good. So that we have 70% only of questions are for moderate candidates. the minimal standard candidate. Your mission as a candidate for this exam to answer these 70%, just them. Because most probably the famous recalls will be outside the curve, the difficult questions will be outside the curve, and the curve will be mainly built on the 70% questions of moderate candidate. What does that means? Don't waste your time reading the sophisticated points. Don't waste your time and effort trying to cover everything. I would like you to cover the most important things that 90% of candidates will answer them clearly. I will give you a very simple example. I know I'm talkative, but this session is very important to clarify the vision of the whole course and your work until the day of the exam. Now, how many people in the exam will answer this question? What is the most accurate investigation for scleroderma in pregnancy? How many candidates can answer this correctly? 10%. Now the next question. A patient in labor, CTG showed variable prolonged deceleration. The head is at +2 and she is primigravida. Okay, how can you deliver? How many candidates will answer this question correctly? All UK candidates will answer it. And most, yeah, exactly. One of our friends answered it already on the chat. Now, if you miss this question, which all people will answer it, you will be outside the curve. You will fail the exam. If you miss the first one, it will never affect your final mark. You got my point, all of you. Okay? Am I right, Zaib? Am I right?
Yes, yes,
You
absolutely.
imagine that. This is the game.
Yeah, I will just add one thing over here is that, you know, the difficult questions are going to be difficult for everyone. The reason, you know, the difference, what it is going to make is that, you know, how beautifully you can handle that question and how you can get the idea from that question. Because some of the questions can be too long to read, and maybe what happens is that, you know, when you read the question, so by reading the first 2-3 lines, you will say, oh, I know the answer. Okay. So somehow, you know, maybe that is not the answer. Somehow, maybe the answer is which is in the last line. That can you please tell me about this? Okay. So
Yes.
don't just get carried away with the long scenario that, you know, this is what the answer which is fixed in my head or which I have to do. So you don't have to do that. All right. So like, I mean, you have to read question carefully. You have to give you know, the reason that, you know, what exactly you want to say. In terms of single best answer, I will just add one thing that, you know, single best answers are quite clear in terms of that you will be knowing the answer once you will start reading the question, number one. And secondly, when you will come to the you know, the answer, you may exclude, you know, the quite nicely the 3 options, and then you are going to be left with 2 options, and 2 options are going to be so close to each other. So what you have to choose? Anyone? What you have to choose out of 2 options? Anyone?
So,
any idea? The best, the best answer. Okay, the best, that is our exam single best answer. Okay, so out of 2, you know, almost close option, you have to choose the closest option, which is going to be the best option for that question. Okay, so at least in single best answers you can you know, the I mean, get to the correct answer. In terms of ENQs, Dr. Hassan has always taught us when we were, you know, in his class, like you guys, he used to say that, you know, do the exclusion criteria. Do the exclusion criteria. So you have to do that.
You still remember?
I do.
Now,
So yes, sir.
this is, you know, Zaib, you know, it's the key of EMQs. I never try to find the answer. I'm always trying to find the impossible answers. Okay.
Yeah.
Then I just remove these answers from my list I will find myself maximally confused between two options. Sometimes one option is very clear. So I will go for it. This is, yeah, perfect. Thank you so much for mentioning this point. Excellent.
No. 4 to 5 options. No, never. RCOG
Impossible.
is not stupid. RCOG is not stupid. Okay, so just
Impossible.
mind it.
In
Impossible.
EMQs,
Oh,
impossible.
it's impossible. It's impossible.
Maximally, two options
2 or
are
3.
available.
2.
Maximum.
Yeah. Maximum 2. Maximum 2. Okay, sweetheart. No. You don't have to think like this, Anusha. What you have to do is in EMQs, let me tell you just one example. For example, of course, in EMQs, you will have 5 questions. Then you will have, the one of the set, the statement. I mean, that is going to show that, okay, out of these options, for example, this is the labor and delivery EMQ, and you have to give us, the all women who are laboring in the EMQ, you have to give the best answer for this. Okay. So, of course, options are going to be from option A to sometimes option S. Okay, sometimes in my times when I was studying back in 2018, so I remember till date that the options were like from A to S, and I had to scan all options for every single question. Okay, so what you have to do is that you have to narrow down your options. Okay, you have to narrow down. You have read one question, and your main task is that you have to do the management of the labor and delivery only. Okay, so you have to narrow down your options. From those options, you just have to focus on which option is talking about the labor and delivery thing. Okay, so this what you have to do. So you are not going to manage the whole pregnancy, you are not going to manage the baby, you are not going to manage postpartum part. Okay, rather you just are going to talk about the labor and delivery options. All right, so this is going to be like, I mean, kind of your approach. Sometimes an EMQ combines between guidelines. Oh yeah, so that is going to give you an idea about Ahmad, that how you are going to incorporate in your head, because
Now,
by the end
Ahmed,
of your
yeah,
preparation.
Ahmed, I
Yeah.
think I mentioned this clearly when I said, you say the same thing I said. The EMQs are complex nature questions, okay? So you need to know the information from the guideline and to need to know how to apply and interpret this information correctly. And this is depending on somehow experience, either clinical or by training with good mentors, okay?
Exactly.
This is how can we manage. And regarding your question, Anusha, I think you are so much excited.
No, or maybe so much prepared for this exam.
Yeah, she's so much concerned about the exam. She's asking about forceps and ventouse. However, I think Dr. Zaib will cover this point clearly in her sessions, of course.
Because I am basically an obstetrician, so of course I
Yes,
have a
Dr.
very good
Zaib,
idea.
she's carrying out the whole risks of obstetrics, by the way. I'm a gynae onc. I left obstetrics for many time ago.
Yeah.
Yeah. I cannot take care of two lives at the same time.
No worries, Anusha. If you are here with us, so we are going to give you a good idea about that vacuum and forceps, or perhaps we are going to conduct another session for this, because this in itself is a big topic to cover. Okay, it's not like that we are going to cover for the exam only. We are going to cover it for our day-to-day practice as well, because this is an important thing to cover. Okay, from this. And regarding to the many guidelines in one, I will come back to the same question which Ahmad has asked, and I think this is a very good question, important question in terms of that. Look, my dear Ahmad. So what happens is that after reading maternal medicine module, for good 2-3 months. So you are going to have a good idea about that how you are going to manage any woman who is ending up in labor and delivery. For example, in terms of if she is a case of spinal cord injury, if she is a case of the SLE, if she is a case of any cardiac disease, if she is a case of any of the the headache in pregnancy as well. So of course, by the end of your preparation, this is not going to be only a headache talk article only. That's going to be incorporated with your labor and delivery guideline. Okay, so you have to be you have to keep this thing in your mind, that by the end of your thorough preparation of the many months, you will be having a good idea that how you are going to solve your questions in terms of labor and guideline. Again, I will say the same, that this is not going to be, the whole question is not going to be only on shoulder dystocia. Whole question is not going to be only on the card prolapse. Of course, there are going to be multiple things. For example, this is a breech who is taking labor trial, and now the cord prolapse has happened. What you will do? So of course, there are going to be two guidelines, for example, or they may say, any of the question from, the breech, or any of the question from cord prolapse. So all you have to do is that you have to read the question carefully. First of all, what your task is, that out of all these options, or out of, sometimes, in EMQs, they give us a clear hint that, this question is all about the prime gravida who is taking the birth trial. And, these are the, the scenarios in which, you have to choose the answer from. Okay. So you have to be very careful. And I'm sure, by the end of your thorough preparation, our mind is up to that level that we can, quickly, the pick the option. So it's not going to be only that, the nice guideline intrapartum care is going to be there. And this is not going to be only that, the shoulder dystocia guideline is only going to be there in the labor part. Oh yeah, Sadia, the recording is going to be there. Don't worry. Clear idea of guideline, Faiza. I mean to say is that clear idea of guidelines. So of course, I'm sure by the time when we are entering into this exam, more or less, half of our, the people who are attending, this exam are already, having some of the post-graduation degree from their own respective, the country, isn't it? So this way or that way, you have a basic knowledge. Even if not from the MBBS, from the MBBCH study, you have a basic knowledge of, the topic. Okay, so basic idea means that, for example, if it is shoulder dystocia, so we know that shoulder dystocia is an obstetrical emergency. Okay, so if you know what exactly the shoulder dystocia is, so it is not going to be the shoulder dystocia after birth. This is going to be intrapartum emergency, isn't it? So yes, summaries, if you want to ask that, the summaries which are available on the website, so these are for your help. Okay, so of course, like I said, like Dr. Hassan said, we are going to be the provider of knowledge. Who are you? You are going to be the taker of that knowledge. How you take that knowledge, how you absorb that knowledge, how you execute that knowledge into your question. So that is going to be on you yourself only. We are just going to give you ideas. We are just going to give you tips and tricks. We are just going to help you around. Okay. So don't like, fix your mind into this thing that I just have to read the summaries, and then, I'm just going to go for this exam. Of course, you can go for this exam. My, the clear idea of guideline saying is this way is that, of course, if you are reading about postpartum hemorrhage, if you are going to read about antepartum hemorrhage, so you have to have idea what exactly the APH is, what exactly the PPH is, isn't it? So I hope, Faiza, I'm clear. Okay. Am I clear on this, Faiza? Okay, that's great. So moving forward from this, so the basic stuff. So I would like to talk about the question which many candidates do ask, that what we have to study, and the question books and everything. So let me just tell you one thing. Almost all these books are there for the practice. Nothing of the sort of going to be repeated from all these, the question books or question pools from here and there. The idea of doing questions is that, you are going to be well versed with your guidelines. You are going to be good enough to solve the questions carefully, because all these books are going to give you, the clear idea that, how you are going to, solve your questions. Okay, another thing, many questions are being, asked here and there on the groups, and, whenever candidates do meet me in person as well, that are these books mandatory to solve? My answer is no. Okay. But yet again, I will say that if you solve all these practice book questions, so this is going to give you a clear idea about the exam. Okay, so it's not always about that, you have to do all these books, the couple of times to have a good idea about exam. No, because, see, all of you, my dears, that, everybody has a different approach. Everybody has different circumstances. Everybody has different, the kind of study, what you can say, that how they study specifically. Okay, So, I mean, it's not like that, you know, if I get idea after reading one time, so the candidates, you know, the like me is going to have an idea in like, I mean, 2 times or 3 times after studying. Okay. So it happens. So everybody has different, you know, the threshold, everybody has different stamina, everybody has different strategy to study from. Okay. So how we recommend as a teacher, as a mentor, as a guide is that, you know, it's a good idea that, for example, that, you know, if one of the certain guideline is in your schedule, if you have finished that guideline, so do try to, you know, solve the questions on that, you know, the particular topic. For example, if it is about shoulder dystocia, okay, let's just take this shoulder dystocia. Yeah. So from the shoulder dystocia, okay, if you have read shoulder dystocia perfectly, and you have clear idea about it, that, you know, the how questions will come and what are the important points and how I'm going to solve. So what you will do, these are single best answers book. Okay. I will show you the EMQ part as well. So Androsizer, my all-time favorite. Okay, Rekha Butankel, it has as SBA part. Justin Cooney, SBA part. You have to do. It has got 10 papers, 5 for obstetrics, 5 for the gynecology. Like Anusha is writing in the chat box that, you know, some of the answers are not that correct. Of course, you know, this is your job as a candidate. Like I already said in my opening statement for this, that you are the one who is going to get a correct answer from, you know, your recommended sources. And what are your recommended sources? Guidelines and talk articles. Okay, don't rely on keys. But the thing is, we are, you know, we don't have any other sources to do all these questions. So almost questions are very good in Justin Pune book. I 100% recommend this book to all of you guys, that, you know, do this question, do all these questions, you know, a couple of times to have a good idea about, you know, the single best answers and the extended match questions. Brian Magowan, 2018 books, pretty new. So yes, again, be careful with the keys. Amanda Jones, although it is a kind of relatively old book, but the questions, 200 questions are, you know, the quality questions. Trust me. I love this book. You know, I thoroughly love this book, Amanda Jones and Brian Magowan. Seema Sharma, although it's an old book as well, but the questions, quality questions are there. Janish Gupta, it's also an old book, I think perhaps 2015 or 14. But again, you know, for the sake of practice, yes, you can do. Succeeding for the SBA part, you have to do Tahir Mahmood, my all-time favorite book. Okay, some of the questions are very tricky, very difficult to answer, and in fact, the EMQ parts are very good, very standardized book, very good. So if you guys ask me that what are the 5 books if I have to choose, okay, in order. So my first order is going to be the Tahir Mahmood, Amanda Jones, Brian Magowan, Justin Pune, and Rosizer. And Rosizer is a relatively new book. It came in, I think, 2019 or somewhere in 2020. So it is a relatively new book. But again, I will say the same. Don't rely on the keys. Don't rely on the explanation. Don't make, you know, a lot of fuss in your mind that, okay, the key is given this. No, no, no. Just follow your own guideline. Okay, if you don't agree with the key, okay, you know from where this question is, isn't it? So open that guideline, open that source. Okay, so this is the only way by which you can get the desired key. Okay, so these are going to be the single best answers. Then the EMQ books, again, Tahir Mahmood is going to be my, you know, the topmost in the list. Andrew Sizer, P. Sinha, it's a very good book. Okay, so it has got 2, you know, the kind of, you can say the portions. One is for gynecology, one is for obstetrics. Very good book. But again, I will say be extremely careful with the keys. Again, I will say that if you are looking at the keys right away after you solve the questions, so don't just make, you know, this thing fixed in your mind that this is the key, why this key is given. Okay, always look back to the previous, you know, the first 2-3 pages where it is written that, you know, when it was published, okay, and which edition it is. Like I said, that, you know, all these books are for our practice. These are not recommended, you know, the sources to study from. Your recommended sources are, again, guidelines, talk articles. That's it. Rekha Butankal, Kalaivani, Andrea Pilkington, Succeeding, Justin Kone, EMQ books. Again, if you have to pick the 2-3 sources to do the EMQs from, again, the Tahir Mahmood, Andrew Sizer, P. Sinha, Rekha Butankal, and Justin Pune. They are going to be my top, you know, the priority books to do from. You know, again, the question remains same, that many people, they do text me that how we are like, going to solve all these questions. Ma'am, I'm getting very upset. I didn't solve this book. I didn't solve this book. Oh, come on. Don't be upset on solving all these books, okay? These are just for your practice. These are not really recommended sources. You have to be upset on something which is very much important. For example, if you haven't studied antepartum hemorrhage guideline, oh yeah, you have to be worried about that. Okay, if you haven't studied postpartum hemorrhage guidelines, so yes, that should be your the reason for being upset. Okay, but not all these books. Okay, am I clear so far, guys? Any question? Hi Asta, good to see you. Thank you, Anusha. Any question, guys? Faiza, you seem very distressed and upset. If there is any question or if something is not clear, please do ask. Kinda, is everything clear, sweetheart? Amreen, Fauzia, Faiza, Sahar, Abda, everyone. Sarah, Shumaila, Swati. If I don't call anybody's name, please don't be upset. From where to get Pasimat, UG and strategy, sweetheart? You have to take subscription for that. Okay, you have to take subscription for Pasimat, UG and strategy. Don't rely on PDF, which are circulating here and there. All right, because the pool is being changed. Well, Ahmad, I do recommend strategy. Okay, if you have time, if you have enough time, okay, so you can do Pasamar Suji questions as well. Because what I know, Pasamar Suji questions are almost like 500. They are not like no, not strategy full, only the question part. Okay, be an RCOG associate, so that's going to be very cheap for you for a candidate. Okay, so be an RCOG associate first. There is a whole process. If you guys don't know how to do that, so do a message to our team members, so they are going to help you with how to do that. All right, Swati, for MBBS report, yeah, how do we read it? So you have to do just like kind of summary. We do provide summary to our course candidate. Okay, I don't promise, but I will talk to the management, and if they allow, they will publish them in open group as well. Okay, don't worry. Hiya, 3 to 4 months enough to prepare for part 2? Look, sweetheart, I won't say that they are like kind of 100% that's going to be enough, because if you are full-time working, if you're a full-time mom, so of course that's going to be little bit tricky, but of course not impossible. Okay, but yes, 3 to 4 months, if you utilize all these 3 to 4 months perfectly in the perfect guide, so I think yes, you can do that. Embrace is likely very general, don't understand what to read and memorize. Yeah. Uh, okay, Amna. Okay, Amna. Hi, Asta. Missed you too, sweetheart. I'm happy that I have seen you over here as well. Okay, Amna. That's it. That's great. For the MB what you have to do is that you have to find out the causes. I'm sure you all know that this is a mother and baby. The death reports. Okay, that in the recent years, what were the main causes of maternal death? Direct causes of maternal death, indirect causes of maternal death, and of course, the all causes of maternal and the neonatal morbidity and mortality. Okay, so you just have to read those important points, and then of course you have to memorize, isn't it? Because in the recent years, there are many changes in the MBBS as well. So yes, you have to do at least 2021, because they have included COVID-19, the aspect in that. I have just shared in my the course group members, but yes, I will share in the open group as well. Then some of the MBBS report 2021, 2020, and 2019. Okay, so you have to cover the basic, the parts from all these 3 reports at least. It should be on your tips, because I have seen some of the question yeah, from that what was the main reason of the death in the 2019 report, and the direct cause and the indirect cause. So of course, you have to have a clear idea about that, and then later, once you are done reading with almost 2 to 3 reports, you have to have a clear idea that how you are going to solve your questions. Okay. So is everything clear up to this part? Is something I was not clear about? You guys want me to repeat anything? Tuba, Yasmin, Sadia, Shabana, Shmaila, Mahrukh. I can see so many familiar names. So anything I was not clear about, please do ask. So online sources apart from this, so of course we always recommend to do questions from strategy, e-learning. We have always recommended pass MRCOG as well. What you have to do, how you have to read it is that at least you have to give a 2 to 3 thorough question practice from strategy till exam. And you have to put more focus on explanations rather than the questions, okay? Because and again yet again there can be some of the explanations which are from old talks, which are from not the the articles, the guidelines which have been they amended lately. So what you have to do again, you have to go back to your guidelines, you have to find out the key yourself, okay? Don't rely on anything. Regarding recall, will you guide us here? Recalls again, the very some of the questions. Okay, my question to the person who has asked. Let me ask you this thing. Let me ask you this thing. Okay, do you think after having the full day of the exam, is it humanly possible to write down 200 questions along with the options? All of you are the open to answer. Is it humanly possible? Like you will get a clear question. Oh my God. Oh yeah, thank you, thank you, thank you. Is it humanly possible? Again, I will ask the same. So I really want all of you to post on this. Okay, write me on this thing. Is it possible? Yeah, Azza. Yeah, 100%. Yeah, exactly. See, that's why I never recommend any of my student, any of my exam candidate who is coming for help. Okay, yes, you can go through recall questions, but don't rely on anything, my dear. Okay. Oh yeah, Ahmad, do you remember when we were studying for part one? Yeah. So we used to fight on silly things. Okay, we used to fight on the questions, and like I see so many candidates are the hey iPad user, I don't know your names. I mean, I don't know who are you, but just let me tell you this thing. See, shoulder dystocia, is it an important guideline or no? Yes or no? Is it an important guideline? Yes or no? Ahmad, what do you think? Very important. Thank you, Anusha. Very important. Yeah, of course. So if shoulder dystocia is coming, if shoulder dystocia is coming every year, so do you think it is getting repeated? Or is it an important question that has to come? That has to come every year. Thank you. Thank you so much, Astha. Okay. So what you have to do is that, of course, I mean, you don't have to forget the important topics. Important topics will always come in exam. So it's not like that recalls are getting repeated itself. Oh yes. Okay. So please put this thing aside in your mind that that how many the questions will repeat. You have to think the other way around. How many topics can repeat? How many important topics can come again in exam? So I will suggest for the recall questions is that okay, you can go through, okay, but what you have to do, what I did when I was studying for my part two, okay. What I did was that I just noted down, okay, the shoulder dystocia came in 2016, it got repeated in 2017, then again 18. Okay, yeah, so shoulder dystocia is my priority guideline to do. APH, PPH, yes, so it's my priority guideline. Okay, yes, infertility, it's my priority guideline. Incontinence, it's my priority guideline. So it's not like questions are getting repeated, my dear, all of you. Please keep this thing aside. Okay, don't rely on all recalls, don't rely on all these questions. Those are the questions which are being collected by candidates like you, candidates like me, candidates like the whoever is going to the exam. All right. So please don't always think that recalls are getting repeated. I hope you got me. I hope you got me, Subhashini. It looks like, because it is so overwhelming to see, okay, yeah, many of the questions seems like but there's another thing. Let me tell you one more thing about this, that for example, I am so well versed with this, like, I mean, the past papers, because I have memorized them. So by the end, when I will come from my exam, so when I'm going to be writing about all these things, so for example, if it was a question from on APH, because I am so well versed in these last 5-year questions, so I will recall. So those questions will going to be in my mind. So when I'm going to write, so some of the questions are going to be exactly same what I know by heart. All right. So this is another psychological aspect of all these recalls. I will again repeat, I don't want to sound monotonous on this thing, is that, please, you don't have to just rely on all recalls. I will repeat the same. I will keep on repeating this thing, that you don't have to rely on recalls. Rather, you have to rely on the questions, the topics which are coming. For example, if it is like obscolostasis, it's an important topic, isn't it? It will come every year. So it doesn't mean that the recall is getting repeated. It's the topic itself. All right. So if it is coming that from obscolostasis, what is the incidence in the Indo-Pak? What is the incidence in Chile? Where is it is the most common? What's the most common, the sign and symptoms for this? Of course, that's an important topic. That's why it's coming. It's not like that because it came in 2016, so it is coming again in 2000. Yeah, the 2022. What about the percentage? Yeah, no. You don't have to read the book explanations, sweetheart Anusha. I will say the same. Okay. For the incidence and percentages, I will come to that point. Okay. How you are going to make your notes and how you are going to make your own notes from every topic there is. Okay. So this is another idea that how you can be a good the guide to yourself. Okay. How can you be of help to yourself? Because help is everywhere, like Dr. Hassan said, help is everywhere. Okay, be it free help, be it like the paid help, but help is there, isn't it? All you have to do is that how you are going to utilize that help. Only that is going to work for you, not the so much of help. I am telling the same thing. The other mentor is saying the same thing. But if you are not, the following the guide, rather you are busy in taking so many sessions, rather you are busy in reading so many messages from so hundreds and hundreds of free groups. So what you are doing to yourself? Aren't you ruining your mental health? Aren't you ruining your eyesight? Aren't you increasing your screen time and putting extra burden on yourself? What you have to do is, again, you have to limit yourself. You have to stay focused. Okay, you have to stay focused. You have to follow. If you are really into the social media things, so of course you have to be choosy and picky in the picking up the which group is doing quality discussion, which has the quality question. There I can get help. If I really the post, so the which of the mentor is going to help me. Okay, so this is what you have to do. Oh yeah, Ahmed, I second. Okay. So it's not like that, out of 100, if you think 15 questions are getting repeated, so it's not like that, the whole paper is getting repeated. All right. So for the incidences and prevalences, see, I understand the struggle because I've been through this. I've been a student like all of you. I know that you all doctors are a little bit poor in, the memorizing numbers. So all you have to do is repeat. My brother, he always used to say that the repetition is the mother of memorization. Okay, so if you repeat, you will memorize. And how you will repeat? For example, I'm in a group. I have posted a question on the soul percentage, 5%, 6%, 7%, 8%, and so on. Okay, I have posted this question, then I have turned off the notification for that post, and I will go back to my own studies, my own work. Then after like few hours, I will come back to that question and I will see, okay, Faiza has answered 6%, Ahmad has answered 6%, Abida has answered 7%, she has answered 6%, and the correct answer is 6%. So if I will just scan all these answers in like 1 minute, by the end of that day, that 6% is going to be fixed in my head for particular topic. Okay, so you just have to revise, Faiza. There is no other way around. All right, so you just have to revise yourself. You have to revise all these numbers again and again. Ask from your study buddy. If you don't have any study buddy, post in a group where you think that you can have help. If you are in, I know you are in our course, so of course if you will post and many of the people will answer back, so of course by the end of the day, that's going to be imprinted in your head. Okay. um can we make another group? Another group for what? For our course, Ahmad? Let me think about it, okay? Because this way or that way, you will have so many notifications, yeah, isn't it? I will think about it and I will talk to you in person for this. Don't worry. Okay, so now I will be talking about this thing and I will ask Dr. Hassan to have his input on this because he's very good in human psychology and dealing with all these things. This thing is important. How successfully fail an exam. How to successfully fail an exam. Yeah. First of all, lack of confidence. Oh my God, I can't do this exam. This exam is too much. It has got so much curriculum. This is too much to study from. So many guidelines, so many talk articles. Oh no, I cannot do that. I cannot do that. So this is the major thing which you have to have. I mean, you have to push this thing away. Okay. You have to be confident enough on yourself that, okay, yes, I can do it. And please remember me saying this all the time. If Dr. Zaib can do it, you can also do it. I am not a kind of extraordinary student. I have worked hard for this exam and other exams as well. Okay. So you just have to work hard. There are, the 2-3 types of people in the world, in the medical field as well. Many people, who are born genius and they study for like one time and they, do go for this exam and they sit. Many people are like, the kind of when they have to repeat so many things again and again. Okay. Because of, the lack of confidence, because of the lack of, the time to practice, because of the lack of the things to study. So there is, nothing bad about it. If you are a hardworking student, so yes, you can ace this exam. Trust me. If you are overconfident, then you are going to fail this exam as well, because this exam needs a lot of focus. This exam needs a lot of study, a lot of practice of questions. Okay, so underconfident and being an overconfident person, this will certainly lead to that, how you are going to successfully fail an exam. Then this thing, following so many advices. Okay, let's join that group. Let's join that group. Let's join that the Telegram or the free course or the free session or the free advice. So what will happen is, by the end of the day, your mind is going to be a kind of the noodle box. Okay, you will have so many things and you are not going to pick the perfect noodle for you. Okay, so many advices. Of course, I'm not saying that somebody is not going to give you a good advice, but of course you have to follow one or two the people. You cannot follow the complete the advices here and there. Too many sources for one topic, like Dr. Hassan said, too many sources. For example, if I have a the source for example the SLE, I don't have any other source. Okay, I don't have any other source to read this SLE. Of course, I will be reading from the TOG article, even though it's an old TOG article. But yeah, what to do? I don't have any other TOG article to study from. I hope you got me. So if you are studying the same SLE from the TOG article, if you are reading the same from any of the recommended source, any of other source, what will happen? Maybe you will have a lot of knowledge, but in the end, you are not going to bring that knowledge into the point which is necessary for this topic. For example, headache in pregnancy, we just have only one source. So don't study this headache in pregnancy from here and there as well. Okay. For example, we do have, the multiple topics on which, the green top guidelines, then we do have a topic from the TOG article as well. Okay. I will repeat the same that, the green top guidelines should be your prime importance to study from. Okay, if something is given in green top guideline and the same thing is given in the TOG article, for example, oh yeah, the good TOG article, OBS cholestasis. For example, there is a TOG article on OBS cholestasis as well. There is a green top guideline as well. So your main focus is first to cover green top guideline for OBS cholestasis, and if you think you have got enough time from that day, okay, if you have given one day to this topic only, okay, if you think that you have got enough time, so then only you can open your TOG article and then you can cover important things. But again, You don't have to, the cram whole talk article on obscolistasis. Rather, green talk guidelines should be your prime importance. Again, following so many or almost every single group on social media, be it on Telegram, be it on WhatsApp, be it on the Facebook. I'm not saying this is a bad thing, but this is time consuming, isn't it? This is time consuming, by like, I mean, if you have dedicated the 6 hours for yourself for this study, and you are wasting like 3 to 4 hours on just reading the messages, on just sending the messages, on just the scanning of the group. So what are you going to yourself? You're just wasting time. You're just wasting from the 6 hours. If you have dedicated those 6 hours for yourself, you are wasting your 4 hours for nothing. Okay, and when the 2 hours are left, you will take a break. Okay, I have to have a tea, coffee. I have to see what my kids are doing. I have to watch TV. I have to listen to any of the the Facebook video or something. So what you are doing to yourself, you are not giving yourself enough time. Okay, yes, follow whatever you think is the dedicated group, or the dedicated advices on social media if you think that can help you. But don't just scan messages, thousand and thousand of messages. Okay, when I was studying for myself for my exam, I never I was never being a part of the so many groups here and there, because it really consumed my energy, it really consumed my eyesight, it really consumed my the time as well, because I worked as the practitioner as well. Okay, OBG, obstetrics, I'm an obstetrician basically. So yes, anytime I can get a call and I can leave. Okay, anytime I can go and do the cesarean, do the delivery, do the emergency dealing or something. Okay, I'm sure many of you are working women plus moms as well, or if you guys are like, I mean, dads. So of course everybody has responsibility, isn't it? Okay, so you have to be like, I mean, on your toes. Okay, you have to be on your toes. If you are doing all these things, so what are you doing to yourself? What is the end result? A demotivated, I cannot do this, oh my god, this is too much, and a lost candidate. Even though you are a part of so many groups, by the end of the preparation, by the end of when you are going for this exam, you will feel, okay, apart from the normal feeling of every exam, there is that I don't know anything, because you are into so many things at the one point in time that you cannot concentrate, you cannot bring the best out of yourself. I hope I'm clear on this. Yeah. Yes, Ahmad. Oh yeah, Swati, you can I will recommend do subscribe strategy. Okay, do take subscription because it is valid for 1 year, and if you take it now, so I mean, yes, it is going to help you. If you pass your part 2 now, then it is going to help you in part 3 as well, isn't it? So just be yourself, just focus, just the stay motivated at all times. So it's not like that you have to follow each and every group. It's not like that you have to engulf all free knowledge, free help which is available here and there. All right, so all you have to do is that you have to be yourself, you have to be confident, you have to be good to yourself as well. Okay, you have to be nice to yourself as well. Don't punish yourself. For example, if I didn't do one guideline in a day according to the schedule, so by the end of the day I will be cursing myself, I will be feeling bad that, oh my god, I didn't do this thing, so how am I going to do that? Okay, remember, there is always a backlog in every student's study. So what is the idea of covering that backlog is that go with the schedule. Okay, go with the schedule. And once you are going to finish that schedule, then in the end, cover the backlog. Or if you think that you can cover in between, then you can cover it in between. Okay, don't be upset about anything. Be nice to yourself. Okay, be little, the good to yourself as well. Because if your mind is at peace, of course, then only you can study well. If you are going to punish yourself for something which you didn't do deliberately, so yes, it is going to cause a lot of frustration, isn't it? I hope this thing is clear as well. So please, you don't have to be, don't let this be you. Plan ahead. Okay, plan ahead from this stage, that you don't need to be demotivated, you don't need to be upset, you don't need to be depressed or something. Yeah, isn't it? Agree, everyone?
I agree.
Hi, sir, sir. Would you like to, give any other advice on this?
Actually, you covered everything in a very, very smart and simple way, Dr. Zaib. Thank you so much for this outstanding session, actually. I think what we are all need to know is the smart studying is better than hard working. Okay.
Hard working. Yeah.
Yeah. You can study 10 hours per day and you will fail the exam. And sometimes you can study 2 or 3 hours per day,
Mhm.
but you can pass the exam easily. Okay. You have to understand what is the exam actually wants from you. You are just a trainee. You are not, maybe you are a consultant, but in
Yeah.
this exam, you are just a trainee. So
Training.
you should know the job description of the trainee in UK. What are the most important things in this job description? Such, for example, I have to manage appropriately emergency conditions. So I should cover emergency situation knowledge very well. But I'm not keen about, or not my job, to cover the sophisticated scenarios or difficult scenarios because I'm not a consultant. So I will refer the case at this point and so on. So if you can, you know, the famous question of you have a cesarean section and you discovered intraoperatively that there's suspected placenta previa, for example. Okay, what should you do in this time? If the patient is elective, I will stop the procedure and call for my consultant. This is how the trainee is thinking. And this is what the examiners want from you. But if you are trying to answer this question from the point of view of consultant, you would say, I will open the uterus in a classical incision. I will deliver the baby and let the placenta away until the spontaneous separation. If there is any bleeding, I will control the bleeding. If not controlled, I will do hysterectomy. I can do this, okay? But in exam, I cannot answer such question like this. I have to stop the procedure and call for help. If you understand this principle simply, you will appropriately answering different questions related to the same point and so on. So I think smart studying is better than too much hard working for preparation. Another point, I'm always preferring that if you can find a study partner, maybe you can contact him or her to encourage both of you are encouraging each other to study, to revise. It will be a very good idea and very good option because as Dr. Zaib explained, too much people around you will confuse you. Too much sources, too much groups will make you lost. So I think one study buddy, which is maybe near from you in language, in level, you will start together, you will, both of you study together, revise together. It will be very encouraging point to cover this exam and to pass, okay? This is my last advice. And before starting the regular sessions in this course, I would like to say best of luck to all people. And as you, all of you knows, mid-exam, we believe in success. So this is very important concept. And we're trying to conduct this concept through all of you and all other friends. Thank you so much, Dr. Zaib, and thank you all of you for being with us today.
Thank you so much, sir, for your valuable time. So yes, this is a perfect, the advice. So you just have to plan ahead. So the key for preparation of success, or the key for preparation for this part 2 exam, general advice is going to be organize yourself. Make folders of all modules, okay, on your desktop, laptop, iPad, MacBook, or even you can get them printed as well. For me, I'm a person of the kind of the printer, the kind of person. So I still till date I print things for me myself, and then I study. You have to have a good grip on all salient points from guidelines and talks, emphasize on facts, figures, percentages like incidence, recurrence, prevalence. Post as many as questions as possible from all available pool. Post where the group which there you are, the following the group, or if you are part of any course. So this is going to help you in memorizing, in understanding things, because once you are going to see the same questions again and again, so the answer is going to be, imprint in your head. Discussion helps, okay, and this you will see one question or anything multiple times. Whenever if there is any confusion in topic, open resources and cross check. This is very much important. Like I said earlier, that if keys are from old guidelines, keys are from the anything which is not relevant from the recent talks or guidelines, so recheck, cross check. Open sources, don't rely on keys. Make your own small notebook, note down all important points from guidelines or talks you read. Like Dr. Hassan said, that discuss with your study buddy if possible. Otherwise, take part in a discussion on group. Okay, because group discussion is very much important. Try finishing your first reading in like 3 months time, then revise them all 2 to 3 months time till exam. Okay, so it is possible. It is not something which is not the possible. All you have to do is you have to put your the mind, your heart, your the all energy into it. You have to be positive towards what you learn and try to absorb it with examples, with references and reasoning. This is very much important. Okay, so where we do step into your preparation as a med exam team. So of course, we do try to help you practically with all the curriculum and preparation method what we have discussed earlier. Yeah, isn't it? So we do try to give you the sources. We do try to give you resources as well to study from. Okay, in terms of the summaries, in terms of online sessions, in terms of recordings, in terms of marks, in terms of the everything, every possible the help. So it doesn't mean that you can just go through. Of course you can just go through, but again you have to study, you have to revise. This is your exam. We are done from this exam, yeah, isn't it? So we are done. Okay, we are MRCOG. Okay, so of course what we are going to guide you is that you have to do this, you have to study this from this source. Okay, you don't have to put extra effort on this, and you have to put extra effort on this as well. Yeah, okay, then only you are going to do that. Oh yeah, after every module there is going to be the module wise test as well, so you have to do that test too. Okay, Swati. So yeah, we do try to the help as much as we can, but again how we are going to deal with this course is we are going to have live sessions on each module, and that's going to be top device. Recordings are going to be available for the later revision, and we know like I said earlier that we all are helping the the Ahmad, you are not a new candidate. Okay, I know you for quite long now, so yes, you can start with summary. All right, and if you think something is not clear to you, so at the same time you can open full guideline and you can just cross check. Okay, because summary is going to be the important things, important the extraction of that topic. All right, so if you think still your concept is not clear, you can only open the guideline and you can quickly go through. So you will have the talk articles, green talk guidelines, summaries, and that are going to be updated till 2022. Some of the mock exams are going to be there, question pools, talk question bank, and of course our the major the thing where we all mentor are going to be there, the study rooms. This is important. They are the dedicated study room where we are going to practice some of the questions plus topic discussions as well. Of course, dedicated mentorship is there. Me, Dr. Hassan, Dr. Kadnia, Dr. Mayada, we all are going to be there with you. Plus continuous psychological support in difficult times. You won't believe, the many people they approach to us, they do talk about their problems and everything, and we do try to help with the best of knowledge. Okay, we do try to give them our shoulders as well to cry on, isn't it? Because this is such a difficult the time. I think I have personally been through this. Okay, and I might the share my the story with all of you when we are going to be in the course. So it's not like always beds of roses for everybody, every candidate. Okay, like I said earlier, we have worked hard for this exam. Okay, so it's not like that if you're not going to work hard, So you are just going to have, like Dr. Hassan said, that in our times when we were studying for this part 2, part 3, we didn't have any help available. Yeah. Okay. So, we have had, the no help available. These days, a lot of help is available there. Okay. A lot of free help is there. In our times, even though people used to take money, but they didn't, guide us in a proper way. We have learned through our failures. We have learned through our, the hard work. We have learned from each other as well. Okay. From each other experiences and everything. So yeah, again, I will say that, we are there. Okay. If somebody, wants to discuss anything about anything, okay. And trust me, that's going to be confidential, because this way or that way, of course, if somebody is coming to us for any kind of help, so that remains confidential. Okay. Because it's a duty of teacher that, a teacher gives support to all of their, the students, not only in the studies, of course, okay, but psychologically, morally as well. All right. So I'm there. Okay. So I'm quite, the easily approachable. You all know me very well. I'm open on Telegram. I'm open on Facebook, WhatsApp, anywhere. If you guys want to talk to me, okay, just send me a message. Perhaps, there may be little delay in replying, because, I'm engaged in so many activities. But yeah, I will definitely come back to you. Okay. So this is all about the course. And, the mentors, you already know Dr. Hassan, me, Dr. Zaib Qureshi, Dr. Pradnya, and unfortunately she's not here to join with us, but yes, she's going to be with you in the course. So, the course duration is going to be from 1st June, okay, till, the exam date. So don't worry about your duty rosters. Yeah. So all schedule, all, the sessions are going to be recorded, and then, you can listen to them as many times as possible. You can extract your points, you can extract your, the notes. And by the way, another, the tip, that how you are going to utilize these live sessions. Yeah. For example, if a session is of 4 hours, and for example, you can't listen to those 4 hour session in one go, so what you will do, you will divide. Okay. For example, there is a time from one module to another module, and we do have dedicated schedule. Yeah. For example, if it is of 4 to 5 days, so you will divide 1 hour daily or 1.5 hour daily. So this way you can finish reading one module, okay, with us, okay, in like, 3 days time. Side by side, you are going to be revising questions, you are going to be solving questions in the group as well, you are going to be, putting your queries, and you are going to be tagging us as well, isn't it? Yeah. Okay. So, this is all, we have to do. Don't be upset that, oh my God, this is 4 hour session, how am I going to listen to this audio? Yeah, it looks difficult, isn't it? But you can also divide it as well. Okay. So don't worry about it. If you miss any session, you can always go back to the MedExam website. You can always open this, and, this is going to be, the anything. Easily, you can do easily. You can make things palatable for yourself. You can make things easy for yourself according to your own, the schedule. See, I cannot fit in your shoes, sweetheart. I don't know what you are going through. Okay. You are a better judge for yourself. I'm just here to ease out, the preparation for you. I'm just here to give you some tips and tricks that how you can go through this exam along with, everything. All right. So remember, of course, I can't be fit, in anyone's shoes. I don't know. And plus, don't compare your journey to anyone's journey. This should be in your mind at all times. Yeah. Okay. Don't compare your success with anybody's success. One of your friend has passed this exam 2 years ago, and you are still waiting for your, the turn to go for this exam. So what? This is what, is the best for you. This was the best for him or her as well. So don't compare your journey. We don't know, what one is going through in his or her life. We don't know, how many battles are we fighting at our own level. Yeah. So all we have to do is that we have to be patient. We have to be compassionate to each other. Okay. We just need to be like, available for each another. All right. So trust me, I've been through this. Okay. I've been through this, comparing your journey to anyone's is not going to help you at all. Trust me, we all are destined for something which is good for us. Or sooner or later, I remember Dr. Hassan saying, that, sooner or later, we all are going to be MRCOG. Nobody is going to ask you later, hey, did you pass this exam in one go? Did you pass this exam in, the 2, 3 times? Okay, the failure, was it the last time? Nobody is going to ask you. The only
Yes.
thing is going to be written on your certificate is that, yeah, khalas, you are a MRCOG.
Yeah, brilliant. Yes, 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 definitely. I appreciate this advice so much because one of the most important things to depress people and keeping them away from focusing on the exam, we are looking forward around them. Okay. One of my friends, we are studying together. He passed, I didn't. Okay. This is really a big mistake. Don't compare yourself to anyone. You have a lot of benefits in your life, advantages in your life. Maybe he or she has not the same. Okay. And I'm always saying this, especially in part 3, people who maybe not able to pass part 3 from the first or maybe second time, I'm always saying to them, do you hear about anyone in part 3 and he cannot gain the membership after this? Never. Once you reach part 3, you will gain the degree 100%. Maybe after 1, 2, 3, 4 times, but you will be MRCOG in one day. It's a matter of time. Okay.
Yeah.
It's a matter of time. Trust that, trust in God, and do your best as much as you can. Don't look around. Try to be focused in your pathway, and this is the shortest cut to reach your target.
Yeah, exactly. I mean, I 100% second Dr. Hassan. And plus, we work as a team. So as a med exam expert team, we are helping you sail through this tough and long journey. Trust me, Dr. Hassan said in the opening statement that, we have had, we do have so many examples. For the people, who were with us from part 1 till they become MRCOG, okay? So it really gives us pleasure that, we have been part of their long journey as a med exam expert team. And like I said, Dr. Hassan, he is like, our teacher, okay? And he is kind of a very senior most, the tutor, and we are so proud of him that, he is a prestigious examiner as well, okay? So you might see us in your part 3 exam too. So don't worry about it, okay? So not in this part 2. And then, of course, we are going to see you in part 3 as well. Asa, for someone like me who read and forget after 5 minutes, is it possible to start the topic, the question, and follow the guideline and talk check rather than read all the, oh yeah, you can do that. You can do that, sweetheart. See, there is no hard and fast rule how you can, mold your study pattern. Okay. So if you think that you can get maximum out of solving questions, so do that. Nobody is going to, so like, I mean, in this way, if you just read the questions, and if you think that, after doing, for example, 10 questions, you got almost 6 out of, the 10, the correct. So it means you are good in that topic. But if you got 2 out of 10 correct, so it means you have to cover that topic properly. Okay. So Aza, I will give you a suggestion, sweetheart, that, it's better to discuss. Okay, it's better to revise with friends. It's better to post questions. It's better to see the topic again and again. So this way, I think you can have a better idea rather than just drooling over questions and then just getting upset that I didn't get the good the score. Okay, so this is a quick glimpse from our course schedule. And today is our first introductory session, and the second session is going to be with Dr. Hassan, and that's going to be on 9th. Okay, so hopefully we are going to see you quite like, I mean, often, and then you are going to be with me for maternal medicine, and so on and so on. And of course, like this, we do have the last minute tips session as well. Plus, we do have some revision sessions too. And this is how we train our students. This is how we give them mini schedules on the everyday. So they will cover the everything on every day. Like from the 2nd June they are going to cover the NICE guideline, then on 3rd June other topic, then 4th June the other topic, and 9th June they are going to have the online session. Yeah, so by the end of like, I mean, 4, 5, 6 days study, so they are going to be well versed. Okay, they are going to be well versed in the urogynecology module, and of course, when they will enter into the session, they are going to be, the good confident enough. Okay, and whatever is going to be important, of course, me, Dr. Hassan, Dr. Pradnya, so any of us who is taking that module, so we are going to give you some tips and tricks how to solve the questions properly, what to extract from everything. Nonetheless, we are going to be with you, of course. Okay, so you are going to be studying on yourself. There are the plenty of guideline summary available. No book, no book, no book, no book, Aska, no book. Okay. Oh yeah, I've answered this, Aruna. I have answered for this question, sweetheart. Okay. So you can do retrograde study as well. There is no textbook, Aska. There is no textbook. Okay. Please mind it. Just guidelines. Okay. So in the last 2-3 sessions, we are going to be having important exam questions revision, okay, the recalls. Plus, you will have exclusive biostatistics workshop that is going to be free for our course members, but of course with a minimal fee out of the course as well. And today we had a very successful workshop on biostatistics as well for the September exam. So you can learn important aspects of exam biostatistics question with our expert mentors. So in the end, there is going to be a revision session. Yeah, you can call it a crash course. You can call it as the fast track course. You can call it anything. But of course, we are going to help you have again another idea. Revise yourself. Okay, revision how you are going to look at the topic with the the eye of mentor. Okay, eye of teacher. What do you expect from the question? What do we expect from the question as a teacher, as a mentor, as a guide? Yeah. So how to read a guideline and TOG article? This is very much important. So you have to write down important incidents, recurrence, any risk factors, any complications, some of the important figures. Yet again, not all of the green top guidelines will have, some of the important figures, because in the recent years, in the recent 2-3 exams, there hasn't been so many numbers. Yeah. But as an exam candidate, as an MRCOG candidate, there is not going to be any excuse if you don't know the incidence of cord prolapse, if you don't know the incidence of monochorionic twins, if you don't know, the twin-to-twin transfusion syndrome incidence. So it is going to be a crime, okay, because this is important, not at this part 2 level. So this is going to be important till you become MRCOG, till you do your part 3 exam as well, okay? So you have to write down. Okay, so from here, I would like to tell it to my all dear course members that you have to have a dedicated notebook. Okay, so write it down on that notebook, because in every session, we mentors, we always tell you, okay, yeah, this is important for exam, write it down. Okay, so if I say write it down, you have to write it down in your notebook. Trust me, by the end of preparation, by the end of thorough 3 to 4 months preparation, you will have your own notebook to revise from, you will have your own notebook to study from. Trust me, you are not going to be in a kind of difficult situation, what I have to follow, what I don't have to follow. Okay, so along with that notebook, I think you can quickly ace this exam. Okay, quickly go through your the curriculum again and again. So I hope this is going to help you in the end of your preparation. Yeah, am I clear, guys? Any question? Any question? Okay. Very good, Aza, Ahmad. I hope many questions have been answered. If something is not clear, please do ask us. We are here to help you, to guide you and everything. Okay. So if there is any question, please do ask. Do write it down. Open your mic. Talk to me. Okay. Welcome. Anytime.
Thank you, Dr. Zaib. Thank you, Dr. Muhammad Hassan. And let's hope we success all of the candidates here
Inshallah.
to success. Inshallah.
Inshallah. All you have to do is you have to stay focused. You have to stay motivated at all times, because there are going to be times when you will be upset. There are going to be times when you will be depressed. Okay. All you have to do is you don't have to stop. Okay. You have to stop when you think you are done. And
Yes,
when you
it's
are done,
It's
Exactly.
about the time management. Also, it's an important
Exactly.
factor. I hope
Exactly.
we be conscious and aware about the time management. It's, yeah,
Exactly.
it
Exactly.
terrifies me.
Yeah, that's what I'm saying. That's what I'm saying, that you can be the better judge, that what time suits you, because many candidates they prefer to study at night time. Many candidates, they prefer to study in the daytime. For me, I'm a morning person. Okay, I can get up at 4 o'clock in the morning, but I can't be up whole night. Yeah. Okay, so that's very important for everybody. How you figure it out for yourself, that how you want to utilize your time and how you want to study. Yeah. Uh-huh. No, I never did busy SPR, sweetheart. And by the way, normally we don't recommend busy SPR. Okay, but if you can do, yeah, you can do. Okay, if you think that you have got a lot of time. But personally, I believe that if you are in a course, if you are doing all these recommended books, which are, I think, somewhere 18 and 19, yeah, 18, 19 books, along with the Passam RCOG, along with StatOG. So I don't think you will have enough time. Okay. About the library thing, the this aspect, technical aspect, my team is there. Okay, if they will guide you, Swati, don't worry about it. Okay, so library is there on our website. So if you guys are not in the course, so you can take a subscription for that library. It's free for everybody. It's free from part 1, part 2, part 3, MRCPI, and almost all the course, the membership programs. So yeah. Okay, so you can quickly go through, and if still there is any question, please ask. Shabana, do write to MedExam Expert official page. Okay, so a team member will help you, sweetheart. All right, you can go to the MedExam Expert website. Or you can quickly log in and you can go through. So from Vaza Previa, let me just give you an overview what kind of questions will come. So prevalence is important, yeah? 1 in 1200 to 1 in 5000. So you have to write it down. You have to write it down at one place, okay? You have to write it down that this is the prevalence of Vaza Previa, yeah? Then what you have to do, this is important exam question. We know that vasoprevia is an obstetrical emergency. And when it is going to be diagnosed? It is going to be diagnosed on vaginal exam. And when you have done an ARM and you see bloody liquor, and at the same time you will see this type of CTG, prolonged decel, or because you have ruptured the connection between mother and fetus, yeah. So on ARM, this is how the CTG will look like. So on exam, so you're not going to think of that this question is from Vasoprevia only. Yeah? This is going to be question on labor as well, along with Vasoprevia GTG. Yeah. Because if you're not going to deal with baby at this moment, so there is going to be fetal mortality in about 60% of the cases, despite cesarean urgent delivery. Okay. So this is how the CTG will look like, and this is important exam question as well. Okay, that there is a patient laboring and you have done an ARM, and on ARM you have found the CTG. What is going to be your best action in that case? This is very important question. Yeah? Then they do ask what amount of the blood has been lost from the fetus. Yeah, so it is almost 80 to 100 ml per kilogram. The loss of what may appear as a relatively small amount, but it will have so many major implications for the fetus. And this is if you guys are coming from part 1, so this has been an important part 1 question as well. Yeah, so what you have to do, because this is an emergency, you have to do cesarean section, you have to do the neonatal resuscitation as well. There can be chances of the blood transfusion for the baby as well. So what do you think? There is a role of ultrasound and the vasoprevia? So practically no, because sometimes you can have a prenatal diagnosis around the time of the anomaly scan, 18 to 24 weeks of gestation. But again, you have to confirm it during the 3rd trimester, 30 to 32 weeks of gestation, and this is also a single best answer, and this has come in 2019, I guess. Yeah, 2020, 21. Yeah. So what you have to do, transvaginal scan, a combination of transabdominal scan and transvaginal color Doppler imaging. Sometimes they can provide best diagnostic accuracy of vasa previa. But moreover, this is going to be a clinical diagnosis. So what you have to do, if it is a confirmed vasa previa, for example, if you have found out on the scan that this is vasa previa, so what you will do in the third trimester, you will do elective cesarean section at around prior to the onset of labor, because you don't want this woman to go into the labor at any time. So you will do it around 34 to 36 weeks of gestation. In asymptomatic women, you will give antenatal corticosteroids. Okay, you will give them around 32 weeks of pregnancy, because you don't know, you might have to deliver it early. And we know that, in preterm birth, we all are giving antenatal corticosteroids. Yeah. So here you can see that, how many guidelines are getting incorporated. Labor guideline, was a previous guideline itself, antenatal corticosteroid. So don't just assume that this question or any of the question is going to be only from one guideline. Yeah. They can ask you that, this is a lady who has been admitted with, the confirmed vasa previa, and she is scheduled for, the cesarean section, and you have decided to give her antenatal corticosteroids. So when you are going to recommend that corticosteroid, so you should be knowing 32 weeks. Then another question can be, what is the dose of antenatal corticosteroid, and which of the corticosteroid do you prefer? It is dexamethasone, is it betamethasone, what is the dose, okay, what is the schedule, is one dose enough, is one course of antenatal steroid is enough? Any of the question can be there. So prophylactic hospitalization from 30 to 32 weeks of gestation in women who have confirmed vasa previa. Of course, you have to individualize, because the purpose of hospitalization is to allow for closer surveillance for signs of labor and timelier performance of cesarean delivery before labor and or before membrane rupture. If there is an evidence of fetal compromise, we know from the CTG, yeah, isn't it? So delivery shouldn't be delayed. This is another question. If there is vasa previa and plus there is pre-labor, premature rupture of membranes, plus and or labor at the viable gestational age. So this is also another exam, the question, ENQ part. What you will do? A category 1 cesarean section. A category 1 cesarean section should be performed without delay. Again, I will say, if it is viable gestational age, if it is like 22 weeks, so of course, you're not going to give a woman unnecessary scar. But if it is 28 weeks, 32 weeks, 34 weeks, yalla, go. Okay, you have to go for category 1 cesarean section. You are doing it to save the baby. Okay, so many of the questions can come, from this guideline. Not only this guideline, but you have to incorporate so many other guidelines as well. Like I have given you an explanation. There can be the guideline of intrapartum care, NICE guideline. There can be guideline of antenatal steroids. There can be guidelines of PPROM or anything. Okay, so don't forget this thing, that how you are going to manage this case. Clear, everyone? Aruna, is it clear to you? Clear, guys? Thank you, Shabana. Thank you so much. Okay, very good, very good. Okay, very good, Aza, very good. So you don't have to forget, the management part of vasa previa, because we know this is an emergency, okay, and you have to deal with it. Very good, Astha. So all you have to do is that, if you really want, our help, and our suggestion, our, the kind of guidance throughout your MRCOG journey, we are open, okay? If you have to join our live sessions, you have to subscribe, you have to go to the MedExam Expert, the .com, the website, you have to sign up, you have to, log in into your account, and then you have to subscribe to our course, okay? And we will really be happy to help you out. And it's not about, the part 2, of course, there's going to be part 3 as well. So, we will be very happy to be the tiny part of your, the success story of becoming a MRCOG as well. Okay, so we would love to hear from you, and of course, we would love to help you back as well. So anytime, you can contact our technical support team. You can contact me, Dr. Hassan. We are, the freely available. We might, respond a little bit, the late, but of course, we are going to be there. All right. So I hope that this session has the even insight of how to prepare for this exam, how to stay focused, and how to utilize your energy, and just to become a good candidate out of the everything. And remember, you have to beat the odds. Okay, you have to beat the odds of becoming a good person the everyday. It's not the possible. Many times it's like, I mean, the kind of the I must say that sometimes we think that we cannot do it. Yeah, but again I will repeat the same. You have to remind yourself, write it down somewhere. Nothing is impossible for me. Okay, what I have to do is that I have to put the extra effort. I have to put my whole heart and the soul into this preparation. All right, if I can do it, you can also do it. Yeah, right. So wishing you all the best in your journey, wishing you all the best in your preparation. If you are part of my course, so of course you are going to see me quite often and you're going to have the quite bit of calls as well, so don't worry about it. And we will try to help you, guide you to reach to your goal. And of course, me, Dr. Hassan, Dr. Pradnia, and everybody from the bed exam expert, so we are going to be with you in your this journey. Okay, so if there is any question, if something which is not clear to all of you, so we are here to answer and help. Yeah. Thank you so much, Maila. Thank you so much, Hajra. You are unable to hear anything. I think there must be any problem at your end. Okay, guys. So here I conclude my session. So if you guys want to subscribe our course or anything, so you are more than welcome. Okay. So our team will help you, guide you. You can easily approach any of us. And if you guys need any of help in terms of the psychological support as well. All right. So it's not always about course. So we are here to help you, to listen to you, to give you a shoulder to cry on, or anything. All right. So looking forward to help you guys, looking forward to hear from all of you. So all the very best. Okay. Don't be slow. Don't just break your momentum. Okay. And oh yeah, it's better, Kinza. If you join the session, so of course you will have a lot of help, sweetheart, because if you will have a lot of online session advice, plus you can listen to all those sessions later on, plus you will have website support as well. So of course it is going to help you. Okay. Okay, Kinza. All right, all right. So here we conclude our session. Thank you so much for being amazing, the attendees, and listening to us for like a few hours or so. But still, if something is not clear and you're planning mini schedule and Facebook is different. Oh yeah, mini schedule is for paid courses, sweetheart, and Facebook is for like the open. Okay, so because we do help, to all candidates who are not part of our paid course. Okay, so we do try to help on Facebook as well. So don't worry. Shumaila, I believe that you are part of our course. So sweetheart, you are going to follow the study room. Okay, schedule, study room. Okay, if you are part of course, so you are going to follow the course schedule. Yeah, because the Facebook group, that is an open group. Okay, free group for everybody there is. Don't get confused. So if something is not clear, do write in your study room. Okay. I know. I know. Okay. So I will see you guys quite often on, in fact, quite oftenly. So see you guys. Okay. Facebook link, Dr. Shabana, you are already there. Don't worry. Okay. Part 2 guide, MRCOG part 2 guide. And I think everybody is part of that group. So don't worry about it. All right. Thank you so much, guys, for being here. Thank you so much for being attentive attendee. Okay, Kinza, do write in to the med exam expert team. Okay, they will definitely help you. All right, you will get the access. Don't worry. Okay, you will get the access. Yeah. So if anybody has any kind of technical difficulty, our support team is there. They are very helpful and they are going to help solve your problems and everything. Okay. So do write to them. All you have to do is that, of course you have to write. And once you are going to be doing that, and then only we are going to help you. Okay. Thank you so much. See you guys in live sessions. Bye bye. Take care. Good night.